Hello, I'm Dr. Aizaz from MedicoVisual.com, and in today's visual lecture, we will talk about the embryology or development of midbrain. So, in the lectures of rhombencephalon, specifically in the first lecture of development of rhombencephalon, when we had discussed the basic concepts of embryology of rhombencephalon, we had discussed that how in the region of rhombencephalon, how the roof plate it widens up or it splays open like this. So you see in this animation in the rhombencephalon region, it splays open like this, right? So this is the situation here. Okay, this was the rhombencephalon region. Let me exactly tell you that this one is the rhombencephalon region, right? But the thing is that in the region of spinal cord, this is the spinal cord, as well as in the region of midbrain, the roof plate in these region, in the midbrain region and in the spinal cord region, in these regions there is no supplying open of the roof plate in this region. So in this region the configuration will be much simpler. So it will be just like that here is the, let's suppose, the neural tube in this region. So it will be simply like that here there will be LR plate in this region. Let's suppose this is the basal dorsal side, right? This is the dorsal side. So here is LR plate and here is the basal plate. So this is basically the arrangement of mental zone, rearrangement of mental zone of the neural tube. By the way, if these terms sound too much alien to you, please watch the initial lectures, the first 2 or 3 lectures of the development of brain, the CNS embryology, first few lectures of neuroembryology. Please watch that, and in those lectures I have explained all these concepts. So in the region of rhombencephalon, this is the arrangement, right? That as there is the supplying open of roof plate, here you see that as there is the supplying open of roof plate, there is also the rearrangement of LR plate. But of course, when there will be no supplying open in the region of midbrain as well as in the region of spinal cord, the arrangement in those areas will be much simpler, and it will be just like that there will be no rearrangement of LR plate. LR plate will remain dorsal like this, as I have explained previously, and the basal plate will remain ventral like this. So this is the situation. I am again and again explaining these things to you because I don't want anyone to remain behind. I want everyone to have a clear concept of this thing. Now, to understand further the development of midbrain, let's go to another 3D model and let's see what happens further. So let's suppose this is a region of midbrain that we have cut here, and here again you can see that dorsally placed LR plate in the midline. Of course, there is the central canal, and ventrally we have these red color basal plate. Of course, the central canal in the region of midbrain, it will form the central aqueduct. We have discussed these things previously as well. Central aqueduct of Sylvius. So now what happens that it's very easy to understand the midbrain embryology. It's not any type of rocket science. It's very clear cut that from the LR plate some of the nuclei will develop from the LR plate and other nuclei they will develop from the basal plate. It's simple as that, nothing more in the development of midbrain. Now again, it's very logical that typically the sensory nuclei they will develop from LR plate, and typically the motor neurons they will develop from the basal plate, except there are of course certain exceptions are there, but generally this is the basic rule of the development in the neural tube or CNS. This is the general principles of development in the central nervous system. So now what will happen that these will expand, LR and basal plate, they will expand and some nuclei will develop from the LR plate, this blue one, and some will develop from the basal plate. And we will discuss what are those nuclei one by one, but let's first color code them. So here I have color coded them. Now let's see what are these nuclei one by one. So let's start from the dorsal side. So here we have these 4 swellings, right? So what are these swellings? These are, of course, they develop from the LR plate, and these are superior colliculi, and inferior one, this one, and behind that there will be another one, that inferior one. These are inferior colliculi, right? So of course they develop from the LR plate, and slightly superior to these colliculi, slightly superior, we have what we call as pretectal nuclei. Basically they are present in the pretectal area, and it is said that pretectal area is at the junction between the thalamus and midbrain. So actually what happens that if I draw a simplified diagram, that here is the midbrain. Okay, so here is the midbrain. Now just on the top of midbrain, there is an ovoid structure, an oval structure here, and this structure is called thalamus. So thalamus is lying just above the midbrain. So basically this pretectal area in which the pretectal nuclei are there, it is slightly superior to midbrain and slightly inferior to thalamus. So of course here will be thalamus, here there will be thalamus. So between thalamus and the midbrain, this is the pretectal area. So here there is the pretectal nucleus, and most of the textbooks, they classify the pretectal nuclei as the part of midbrain, but embryologically it is said that some people believe that they develop from the LR plate of thalamus. Embryologically, some authorities believe that pretectal nuclei, they develop from LR plate, but some authorities believe that they develop from the LR plate of not the midbrain but LR plate of the thalamus, right? So this is important point to understand. So from the LR plate, what things develop? They form the pretectal nuclei, and most importantly they form the superior and inferior colliculi. We will discuss what they do in a minute. And of course, surrounding this central canal, which is basically now central aqueduct of Sylvius, surrounding it is some gray matter, and this gray matter is called periaqueductal gray matter. So this circular gray matter in this region, this gray matter in this region, it is called periaqueductal. Peri mean it is surrounding, and aqueduct is of course aqueduct of Sylvius, so it is surrounding the aqueduct of Sylvius, so it has got a very logical name, periaqueductal gray matter. So this periaqueductal gray matter, its dorsal part is develops from the LR plate, and its ventral part, it develops from the basal plate. So again, it's very logical and easy to understand, nothing complicated here. And then the most important structures in this area, the cranial nerve nuclei. So we have the somatic nuclei in this region, the nucleus of third cranial nerve. Okay, let me show you exactly. So here is the third cranial nerve nucleus, and this also. So this is basically somatic motor or general somatic efferent nucleus. Again, if you don't understand what is the meaning of general somatic efferent, general visceral efferent, and other related terms, I have a complete lecture series specifically talking about these terms. Please watch that on YouTube. So anyhow, this is a third cranial nerve motor nucleus which will arise from here, nerve will arise from here, and it will supply the extraocular muscles of the eye. Most of the extraocular muscles of the eye, except two, we will discuss the details in anatomy, not in this lecture, right? Along with that, we have this general visceral efferent nucleus of the third cranial nerve, and it has got a bit of complicated name. It is called Edinger-Westphal nucleus. It is nothing more than the parasympathetic nucleus of third cranial nerve. It is supplying the general visceral efferent fibers to third cranial nerve, right? And then the second one here is the fourth cranial nerve. It is the trochlear nerve nucleus. Fourth cranial nerve, trochlear nerve nucleus. Of course, all these are motor. All these cranial nerve nuclei, all these are motor. So anything related with motor, it is typically derived from basal plate or alar plate. The answer is simple. It is derived from basal plate. So it's very easy to understand that they develop from the basal plate, right? Then if we move forward, then we have this red nucleus. These are the red nuclei. They are red in color because they are highly vascularized. They have a lots of blood supply, so they are bright red in color. So these are red nuclei. Why they have such a high blood supply? Honestly, I don't know. Maybe because so much metabolism is going on in this region, so much activity is going on. Honestly, I have no idea. Literally, I have no idea. Then the other important structure in this region, which looks like chocolate brownie in this 3D model, this dark thing, right? It is called substantia. It is called because it is dark in color. Again, I don't know why it is dark. Of course, I know that there are some dark pigment here, melanin pigment here, but what is the function of that I don't know. So this structure is called substantia nigra, from that N word. So substantia nigra. So yeah, that was it. Unfortunately, many of the things in neuroanatomy and neurophysiology and neuroembryology, we don't know many of the things. Neurosciences, they are sort of mystery, I think. So only a few things of these sciences that we know and that we are teaching, but many of the stuff of these subjects, they are still a mystery. Hopefully someday we will know that what exactly they are doing. We will know the function of each and everything, and then I will be very excited to teach you all the nitty-gritty details, and I will be very happy person on this planet. So anyhow, I am a bit sad that we do not know many of the things of neurosciences, unfortunately, but this is what it is. Okay, now what is this region? So here actually, if I show you further, that here you have your brain, and from the brain, I mean from the cerebral cortex, of course this is also brain, this is midbrain. So from the cerebral cortex, some descending fibers or motor fibers will arise, and they will pass through this region, right? They will pass through this region in this area, right? And if I then remove this, so here are those descending fibers. So these descending fibers form what we call the structure as crus cerebri. So this structure, which consists of descending fibers from the cerebral cortex, this is called crus or crus. I don't know how to exactly pronounce it. Crus cerebri. It consists of the fibers that are going to spinal cord. Okay, let me show you quickly that. Okay. So this is the midbrain. This region is midbrain. Now some fibers are going down from the cerebral cortex. So some fibers are here is the pons. Some fibers are going to pons, and in the pons they will synapse with pontine nuclei here in this region. So pontine nuclei, and from the pontine nuclei they will go back to cerebellum. So these are what? These are corticopontocerebellar fibers. So one type of fibers are these. Then the other type of fibers that will go down from here and they will reach the spinal cord, and they will give orders to muscles to move the muscles and so on. So these are corticospinal fibers. So corticopontocerebellar fibers, corticospinal fibers, and then of course in the brainstem we have the cranial nerve nuclei, and orders to cranial nerve nuclei, they are ultimately coming from the cerebral cortex, especially for the voluntary motion, for the voluntary movement. The orders are coming from the cerebral cortex. So these fibers are corticobulbar fibers. So we have basically three types of fibers in this crus cerebri. We have corticopontine fibers, which will of course form the corticopontocerebellar tract. Then we have corticospinal fibers, and then all these are of course coming from the cerebral cortex. And finally we have corticobulbar fibers, which are going to the brainstem nuclei, the cranial nerve nuclei and the brainstem. So these are corticobulbar fibers, right? So that was it. And finally, if we talk about the cranial nerves in this region, the third and fourth cranial nerve, the exit of third cranial nerve from the brainstem is simple and straightforward, that it arises like this and it comes out from this region. By the way, between these two crura, these two crus cerebri, between these two crus cerebri, here is a bit of, you can say, a fossa or depression in this region. It is called interpeduncular. It is called interpeduncular fossa. Interpeduncular fossa. So the third cranial nerve is coming out from this interpeduncular fossa. This cranial nerve is having two types of fibers. One is from this motor nucleus of oculomotor nerve, general somatic efferent nucleus of the third cranial nerve, right? So this is going to supply the voluntary muscles of extraocular muscles of the eye, most of the extraocular muscles of the eye. And the other one are the parasympathetic fibers, which arise from the Edinger-Westphal nucleus, right? So these two fibers. Then if we talk about the fourth cranial nerve, it has a bit of unique type of route, that fibers, they arise from this and they go back like this, and they decussate at the back side of midbrain, and they come forward like this. So this is the fourth cranial nerve. Now again, I don't know why they are going back and why they are decussating in the back of midbrain, why they have this unusual route, but this is what it is. Unfortunately, I don't know the details. So this was the basic idea of development of midbrain, the midbrain embryology. That is the basic things that you must know for the embryology. And if you only want to know basic concepts of embryology of the midbrain, you can skip the lectures beyond this point. That is it, and that is enough for most of you people. But beyond this point, in this lecture, I will explain briefly some of the functions of these structures. Of course, each of these structures, they warrant a separate lecture. One or two or lecture can be made on each of these structures, but of course I will not go into details of physiology, but I will give you very brief idea of what these structures are doing. And I will start from the dorsal side, and then I will move ventrally, and I will discuss briefly their important functions. And before that, let me tell you that we also have reticular formation in this region. In the brainstem, we have the reticular formation, and of course midbrain is also the part of brainstem. So we have reticular formation in this region as well, and it develops mainly from the basal plate, but there is some contribution from the alar plate as well. So now let's briefly discuss the functions of these structures. So if we start from the dorsal side, we have superior and inferior colliculi. Now please understand one thing. Okay, let me draw a diagram for you that, okay, let's suppose that here is this person with a fat face. Let's suppose, I'm not fat shaming anyone. Here let me draw his eyes, and here as well, and here is the nose, and here there are ears of this person. Now let's suppose that eyesight of this person is not great and he is wearing the glasses, right? He is wearing the glasses, and here is the glasses as well. So now here you notice that the glasses are sitting on the top of ear, and that is how glasses are typically placed. My glasses are kind of misshapen, but I hope you got the point that the glasses are, this is the, let's suppose, ear, and the glasses are sitting, resting on the top of ear like this, right? So in this way you can understand that glasses or eyes or vision related thing is a bit on top, as and the ear are slightly on the lower level. So you can understand that superior colliculus, which is of course superior at the upper level, this is superior colliculus, it is slightly at the upper level, and this is inferior colliculus, it is at the lower level. So superior colliculus, it is related with vision. You know, eyes are slightly above the ear, so it is related with vision. And the inferior colliculus, you know, the glasses are sitting on the ear, so ear are slightly lower. So inferior colliculus, it is related with hearing. Now what exactly are their roles in hearing, we will again not go into details, but basic idea let me tell you here, that regarding the superior colliculus, it is getting some of the fibers here, some of the fibers from the retina, from the optic nerve, these fibers are coming here, and it is involved in reflexes. For example, in your peripheral vision, let's suppose you are in a jungle, let's suppose, and in your peripheral vision you see a lion coming. Immediately your fight flight response will be activated, and you will run and you will move your eyes toward the lion to see from where it is coming, right? So that is bit of a reflex, right? So that is bit of a reflex activity, and superior colliculus is involved in that. Besides that, superior colliculus has different role in visual processing that we will not go into detail. Regarding the inferior colliculus, it has some similar role in, for example, the startle reflex, the auditory startle reflex, and it has also most important role, it is involved along with, there is another structure called superior olivary nucleus. Okay, I am talking in the air, I think I should draw the diagram to make you understand the inferior colliculus. Inferior colliculus is relatively more important in our context because it is also the part of the auditory pathway. So let's draw the auditory pathway quickly, that this is the midbrain, right? Then okay, let's draw the thalamus as well, and of course let's draw the cerebral cortex as well. Okay, so midbrain, interpeduncular fossa, pons, and then we have what, the medulla, right? So in the pontomedullary junction, here we have the cochlear nuclei in this region, dorsal and ventral cochlear nuclei, and of course we have the ears, and from ears, from the cochlea specifically, from the cochlea of ear, very rough diagram, but it will help you understand that from the cochlea of the ear. So from the cochlea of ear, the auditory impulses, they will travel to what? They will travel to the cochlear nuclei, and here they will decussate in a specific way to form what we call as trapezoid body. They will also meet with each other, and then ultimately they will decussate and they will move upward. And in the pons we also have superior olive. We also have inferior olive. So in the medulla we have inferior olive, right? In the medulla we have inferior olive, but the superior olive or superior olivary nuclear complex, that is in the pons, right? So here we have superior olive, right? So after going to superior olive, ultimately then these fibers will go to the inferior colliculus. They will go back to inferior colliculus. We have the superior colliculus, okay, in the back region, back of midbrain we have superior colliculus, and we have inferior colliculus. So here these fibers will go to, they will go to what? They will go to inferior colliculus, right? Now, and of course these will cross talk, these inferior collicula, they will also cross talk with each other. They are interconnected with each other. Then from the inferior colliculi actually, they will go to medial geniculate body in the thalamus, and from medial geniculate ultimately they will go to temporal cortex, in the auditory cortex, basically in the temporal lobe. So this is the auditory pathway. Now one thing you will notice that in this auditory pathway, inferior colliculus is basically a component. It's a relay station in the auditory pathway, and it is involved in audio processing. It is involved in processing the auditory signal. So that is why inferior colliculus is an important component of this auditory pathway as a whole. Second thing is that it is very important in the localization of sound, that how will you know that sound is coming from right side or back side, or which side, right front or top. There are many ways to know this, and it's a complicated pathway. Of course we will discuss it in neurophysiology. We will have a 40-50 minutes lecture specifically on this topic, but briefly if we talk about that, okay, this is right ear and this is left ear, right? So let's suppose that if a person is on the left side, and this person is speaking, naturally there will be more loud sound will be heard on left side and less loud sound will be heard on right side. So inferior colliculus along with this superior olivary nucleus, both of these are involved in auditory localization. So both of these, through some complicated mechanisms that we will discuss later, what they will do is that they will compare that from which ear there is louder sound that is being heard, right? They will compare that from which ear louder sound is being heard. And in this way, of course, if left side ear is hearing a bit louder sound as compared to right ear, they will sort of calculate that most likely the person who is talking is on my left side. So even if, for example, someone is talking in front of you and you close your eyes, you will know that the person is talking from which direction, right? Or from which direction the sound is coming. One mechanism is this. The other mechanism is that of course, as the sound will go from left side, it will immediately reach to left ear first, and with a very little delay of a few milliseconds or microsecond rather, then it will reach to right ear. So there is a little bit of delay in the timing. So these two structures, inferior colliculi and the superior olivary nuclei, they can also judge that there is some time difference. So they can also calculate with that precisely that from where the sound is coming. They can localize the sound. And of course the pinna is not simple, it has a complicated shape. So this complicated shape, it also modifies the quality of sound, and with that it can also somehow help in determining localization of the sound as well. So there are various mechanisms, but the thing is that inferior colliculi is one of the important component of those mechanisms. And the second thing is that if let's suppose this is the midbrain, now what happens that here there is the reticular formation, and let's suppose I have cut a section at the level of inferior colliculus. So here is the inferior, here is the inferior colliculus, right? Now let's suppose that if a very loud sound is heard, so this sound will reach to inferior colliculus, of course, through the auditory pathway. And if the sound is very loud, what will happen that from the inferior colliculus, fibers will go to reticular formation. And reticular formation, what it will do, it will first activate your brain, right? It will activate your brain through reticular activation formation. You will become very active if you hear very loud sound. That might be alarming situation, right? So second thing is that from the reticular formation, the fibers will go down, the reticulospinal fibers, they will go down in the spinal cord, and they will cause movement of your body, so that you might start running, or you might start startling, you might move your body towards the stimulus and so on. So that is called acoustic startle reflex. So inferior colliculus is involved in that. And of course some people also believe that here is this periaqueductal gray matter. So periaqueductal gray matter might also be involved in this pathway. Some people believe that from the inferior colliculus, fibers go to periaqueductal gray matter, then from periaqueductal gray matter, fibers go to reticular formation, and then to spinal cord through reticulospinal fibers. So this was basic idea of superior and inferior colliculus. I have deliberately skipped the detail of superior colliculus, but inferior colliculus is a bit more important in this context. Now, if we talk about pretectal nucleus, we can discuss the pretectal nucleus along with the Edinger-Westphal nucleus. And for that, we will have to briefly discuss the visual pathway. So let's suppose this is your eye, and this is, let's suppose, left eye, and this is, let's suppose, right eye. Now the light waves are falling here like this, and here as well, right? And here is the retina, and it is forming the optic nerve. Okay, I have drawn it wrongly. This is the optic nerve. Here is also optic nerve, and here there will be crossing over of the fibers, and these fibers will go to lateral geniculate body. The auditory, they go to medial geniculate, but they go to the visual fibers, they go to lateral geniculate body of the thalamus, right? So here is the thalamus, they are going to lateral geniculate body. But along with that, some of these fibers, and by the way, from lateral geniculate body, they will go through the optic radiation to the auditory, to the visual cortex, or which is in the occipital region, right? Now these fibers are going here, but some of these optic nerve fibers, they will also give collateral to the midbrain, and specifically to the pretectal nucleus. They will give collateral to pretectal nucleus, right? So here is, let's suppose, okay, let's draw with another color. So here is the pretectal nucleus. So some of this visual information from the optic nerve, it is ultimately going to pretectal nucleus as well. So here this pretectal nucleus is receiving the light waves, and from pretectal nucleus, this pretectal nucleus will send fibers to Edinger-Westphal nucleus. Let's use another color. Okay, so here it will give fibers to Edinger-Westphal nucleus. So of course we have Edinger-Westphal nucleus here. So it will give the fibers to Edinger-Westphal nucleus, and then from Edinger-Westphal nucleus, Edinger-Westphal nucleus is forming the parasympathetic efferent fibers of the third cranial nerve. So these parasympathetic efferent fibers, they will then from Edinger-Westphal nucleus, it's not anatomically correct diagram, but you can understand it. It will go to constrictor pupillae muscle. So let's suppose what happens that if someone shines a bright flashlight into your eyes, here as well, if someone shines a bright flashlight in your eyes, your pupil will constrict. This is called pupillary light reflex. Now in this reflex, the pathway is like that from the retina to the optic nerve, light rays are going, light information is going to the optic nerve and optic chiasma, then optic tract, and then from here the information is going to pretectal nucleus. From pretectal nucleus it is going to Edinger-Westphal nucleus, and from Edinger-Westphal nucleus, of course I have skipped the details that there is the ciliary ganglion and short and long ciliary nerves, but ultimately they are going to constrictor pupillae muscle, and that muscle will be stimulated and pupil will be constricted. Pupil will become smaller, it will become constricted, right? So this is called pupillary light reflex, and pretectal nucleus and Edinger-Westphal nucleus, they are involved in this pathway of pupillary light reflex. That is the most important function of these two nuclei. And of course we had discussed a bit about the third nerve nucleus, the somatic motor nucleus of the third nerve that supply the voluntary muscle, voluntary extraocular muscles. We have also discussed the reticular formation in the previous lecture, but what about the periaqueductal gray matter? Now, one function we have discussed about the periaqueductal gray matter, that it might have some role in acoustic startle reflex. The other function is that some authorities also believe that these nuclei, Edinger-Westphal and these cranial nerve, third and fourth cranial nerve nuclei, they are embedded within the periaqueductal gray matter. So some authorities believe that they are actually the component of periaqueductal gray matter. But along with that, this periaqueductal gray matter, they also have some special neurons, and these special neurons, what they do is that they send fibers downward. So okay, let me draw a simple diagram. That let's suppose this is the periaqueductal gray matter. Some nuclei in this periaqueductal gray matter, they send nerve fibers downward into the spinal cord, and in the spinal cord we have the lateral spinothalamic tract that is involved in sensing of pain and temperature. So these are sensory fibers which are taking pain information. So let's suppose here is the pain receptor, so it is taking the pain information in the spinal cord. Now these fibers, these downgoing fibers, they will release certain pain modulating factors, for example enkephalins and other morphine like substances, and they suppress the pain, they modulate the pain, right? They modulate the sensation of pain at this stage, at the spinal cord stage. And there are some fibers that are actually coming from the cerebral cortex to these periaqueductal gray matter, and they may order this periaqueductal gray matter that please release some morphine like substance, some painkillers at the spinal cord level. So that is another function of periaqueductal gray matter. And now these red colored beautiful balls, the red nuclei. Okay, let's first draw the diagram, then I will explain these things to you. So in the medulla we have, this is the pyramid, right? And lateral to pyramid here in this region we have what? We have inferior olive. So here we have inferior olivary nucleus. inferior olivary nucleus here. As we have discussed that there is the superior olivary nucleus, similar to that we also have inferior olivary nucleus, and we have discussed previously as well that fibers are going from the climbing fibers. Basically they are going from the inferior olivary nucleus to the cerebellum, right? Inferior olivary nucleus to cerebellum. Now from the cerebellum then some fibers are going towards the, here is the red nucleus, right? So here is the red nucleus. So fibers are going from the cerebellum, fibers are going towards the red nucleus, right? And then from the red nucleus, the fibers are going towards the olive, inferior olivary nucleus. So you see a loop has been formed that from the inferior olivary nucleus fibers are going to cerebellum, from the cerebellum fibers are going to red nucleus. These are basically going from the dentate nucleus of the cerebellum, and that is dentatorubral fibers. So from dentate nucleus to red nucleus, dentatorubral fibers, and then from red nucleus towards the inferior olive, rubro-olivary fibers. So in this way a loop is formed, and in this way they are talking to each other. All these structures, they are talking to each other, and that is why red nucleus has some important role in the coordination. And what exact role is that? It is said that it has some role in motor learning and error correction. We have discussed that olivocerebellar tract, it is involved in error correction, right? So it has overall, this loop has some function related with error correction. What is the function, how it works? We don't know honestly, but we will discuss some theories, some hypotheses later when we will talk about neurophysiology. So one of the important function of red nucleus that it is related with the coordination. The other thing is that the red nucleus, it is sending directly downward fibers directly to spinal cord. It is sending downward fiber directly to spinal cord, and this is called rubrospinal tract. It is called rubrospinal tract. Now this rubrospinal tract in humans, it is somewhat rudimentary. It reaches only up to upper few cervical region, 3 or 4 I think cervical spinal level. It reaches only up to that. Below that it does not go beyond that. So it has some role in flexion. It has some role in stimulating the flexors of your body. Actually red nucleus is also receiving the fibers from the cerebral cortex. So from the cerebral cortex, corticorubral fibers are also coming. So actually in human we have properly developed fibers that are going directly from cortex to spinal cord, corticospinal. So this tract is not much important in human because we have corticospinal tract. So this is basically an additional or backup tract that is there. But in humans it is not well developed and it has not very important role. So these are two basic functions of red nucleus. Beyond that there are many important other functions of red nucleus as well, that again we will discuss in the neurophysiology. And finally this black thing, Substantia nigra, it is very important structure actually. So Substantia nigra has some important role, especially in initiating the movement. It is the part of basal ganglia. So one of the other component of basal ganglia is called striatum. Striatum consists of two structure. It is called striatum first, and it consists of caudate. It consists of caudate. These are the name of structures, caudate and putamen. So basically the Substantia nigra, it forms dopaminergic neurons, dopaminergic nerve fibers which release dopamine, right? So these dopaminergic fibers, they help in initiating the movement, and if they are destroyed somehow genetically or due to any reason, if they are destroyed, it causes decreased movement, akinases and mask like faces and tremors and other symptoms that we call as Parkinson's disease. It can also be artificially generated if we give dopamine antagonist drugs, so that leads to Parkinson-like symptoms anyhow. So this is the important function of Substantia nigra, that it has some important role in initiating the movement, and how exactly it does that is not the topic of today. So I think that's all basic things that are related to all the structures that we have discussed already. Is there anything else left? I don't think so. So okay, that's all. Thank you so much for watching this video. I hope you learned something from this visual lecture. Have a great day. Goodbye.